When hearing the word cancer, the most common types that usually come to mind are breast, colon, and lung cancers. These and other types of the disease account for over 90% of all diagnosed cancer cases. There is, however, a growing sector of cancers that most people don't even know of, much less think about. Head and neck cancer make up only 3% of all cancers in the United States, but they're often discovered in late stages because most people are unaware of their risk factors and symptoms.
At the end of high school for me, I think it was my mom had noticed just a pigmented, spot on my upper lip, and my dentist had actually noticed it as well during just a normal teeth cleaning, and had sent me to an oral surgeon just to make sure that everything, was okay. And they said it was nothing, to worry about. It was a birthmark, and sent me on my way. They didn't do any type of testing. So fast forward probably to 10 years later, around 26, I just noticed that the spot that they had said was a birthmark was, growing. It was moving to the other side, inside of my lip, actually. And so that's when I got the news that it was, in fact, melanoma. And at that point, your head just kind of explodes, because this is something that happened, 10 years ago, and somebody had told me, there was nothing wrong with me.
Some of the common symptoms of head and neck cancer can be sores that don't heal, difficulty swallowing, ear pain, hoarseness, discoloration of moles or lesions on the face or the neck. If those symptoms last for more than several weeks, you need to go in and see someone, a physician, who is capable of looking at those areas and making sure something more ominous isn't going on.
Across the board, the most common risk factor for all head and neck cancers is the use of tobacco and alcohol products. While this of course seems obvious, there are other risk factors that might surprise you. HPV fuels tonsil cancer. In fact, this diagnosis is growing among young adults who have HPV.
Doctors, dentists, and healthcare providers in general should definitely inform their patients about the risks of HPV. Certainly the most common or known cancer associated with HPV is cervical cancer in women. However, now tonsil cancer and back of the throat or pharynx cancer is associated with HPV.
Reflux is another risk factor. While seemingly benign, persistent and chronic reflux can cause esophagus and throat cancer.
Reflux, as you know, can cause heartburn, it can cause hoarseness, it can cause abnormal throat clearing, and those symptoms often are very common and initially non-threatening. But reflux can also cause esophagus cancer, and it's also been shown to be a risk factor for larynx or voice box cancer.
The good news is all types of head and neck cancers can be treated with great success if they're caught early enough.
When I was 48, I felt a lump on my neck, and went to my doctor, and I was diagnosed with squamous cell carcinoma. I had to go through the whole gamut with chemo, surgery, and radiation, but it is a type of cancer that responds well to treatment, and I am cancer-free today.
It's the 6-letter word you never want to hear from your doctor. But as we learn more about cancer and what symptoms to look out for, we can expect better treatments, better outcomes, longer lives.
Certainly, your training is extremely important, and having the finest treatment available, whether it's chemotherapy, radiation therapy, surgery, or any combination. But unfortunately, 60 to 75% of these patients present with advanced disease. The only way we're going to make a change in that is to detect this cancer early. We've got to change that statistic. We've got to turn it around. So it's not 75% of patients presenting late, but 75% of patients presenting early.
Established in 2001, the Dobleman Head and Neck Cancer Institute was founded as a refuge for those diagnosed with head and neck cancers. The philosophy here is that cancer is more than administering tests, drug treatment, radiation, and surgery. It involves meeting all aspects of a patient's needs, from the physical to the emotional and spiritual.
The psychosocial impact of cancer is devastating to patients and their family. And so if we can make a patient feel better, give them hope, and tell them that they've got support from their family, from the cancer team, it makes them feel better, their quality of life improves. I believe their prognosis is improved from my personal observations, and it's the right thing to do.
The Institute goes beyond treating cancer, working year-round on research, free screenings, clinical trials, and so much more.
Dentists and hygienists in particular are on the front lines. They're often the ones that will find cancers early, particularly oral cancers. What we do is we go around the state and we try to give conferences, give talks to dentists either at their office or at a major conference, and tell them to look for some of the early warning signs and some of the symptoms that an early head and neck cancer patient would have. I think that's going to make a critical impact in these patients.
Dr. Dobleman's dedication to his patients' quality of life is unmatched, and his patients couldn't be more grateful.
For a long time, I just thought, I was his favorite, and so he, favored me and gave me excellent treatment. But I've been in enough surgical centers, his office, so many times, and I can hear him in other rooms with other patients, and it's the same for everybody. He's just very caring and compassionate, as well as being one of the best at what he does, probably in the country.
When you're going through the different treatments and stuff, it really wears you down, the chemo, the radiation. But you come in and you see Dr. Dobleman, and you leave and you feel like the luckiest person in the world. You feel like $1 million every time.
If you or someone you know suffers from any of these symptoms for a prolonged period of time, schedule an appointment with Dr. Dobleman today. Diagnosis is fast, painless, and easy. If cancer is found, a treatment plan is customized for each individual patient. The Dobleman Head and Neck Institute, committed to treating the whole person.